Hello everyone, I believe you're fine, and I know your family is also fine. If you're sick, may God grant you healing. I'm still continuing with the issues of children's dentistry, and I want to equip you parents with enough knowledge so that your babies can have a good life, your kids can have better oral hygiene, and enjoy. So we've been looking at this. Now it's quite a number of series. So today I'm going to begin tackling baby bottle teeth decay. This is what we call baby bottle dental caries or bottle caries or baby bottle dental or tooth decay. In simple terms, you have a baby 2 years old, 3 years old, and you see his or her teeth, especially the front ones, getting holes or beginning to wear off, the enamel is wearing off. That is called baby bottle teeth decay. And it mostly appear or occurs in the upper teeth, especially the upper two teeth. That's how it begins, then it goes on wearing and going on, just as you can see in that image. Yes, that one, that one, that one. It's a very serious issue these days, especially with the rising diety. These days, people are changing diety. These days, mothers are no longer breastfeeding for 6 exclusive months. These days, you find a baby 2 months with a bottle. So, anyway, it is fine to have a bottle, but it has issues. And what could be the core causes of these caries or this decay? One is frequent or prolonged exposure of baby's teeth to drinks with sugars. Your baby is 2 years old, 3 years old, is using a bottle. Maybe it's even just 8 months, is on the bottle, which is fine. But now we are saying if you frequently put these sugary drinks in a bottle, then you are exposing your baby's teeth, and the highest risk is this baby's teeth can get caries or can get holes or what we call cavities. So, my dear parent, if it is time to feed the baby, put whatever you want to put in a bottle, give them, and for that specific time, stop. So don't leave the baby with a bottle for an hour, 2 hours. It's busy suckling on that bottle. You are endangering your baby's life. Some parents have a tendency or a habit because their babies are stubborn, they are fussy babies. So you get a bottle, put in the mouth, and put the baby to bed. Maybe with sugar or sugar water. Yes, parents there get water, put sugar, and put in a bottle. Because it is sweet, the baby will continue soaking the bottle until they sleep. Yes, it helps you. Your baby will go to bed, your baby will sleep, your baby keeps quiet. But in the end of it all, you are hurting your baby's teeth. So please, from today, stop putting your baby to bed with a bottle. It is not advisable and it is not good at all. Sometimes parents use a bottle as a pacifier. Yes, that one in the image is a pacifier. So you are using a bottle instead of a pacifier. Pacifier is just meant to have the baby relaxed and pussy on it with no sugar, with no liquid, with no tea, with no milk. Just that's a pacifier. But now, because you don't have a pacifier, you get your bottle, you put honey, you put maybe juice, you put water, and you give your baby. 5 hours is in bed with a bottle in the mouth or playing with a bottle in the mouth because you're busy working on your course. You are exposing your baby's teeth, which are not yet even strong enough, to sugar, which will eventually destroy all your baby's teeth. And sometimes, this one is a fact which you should understand, you parent. In most cases, parents pass the bacteria that destroys teeth, which we call the streptococcus, onto the babies. How? Through saliva. You parents have a tendency of kissing your babies. You have a tendency of checking temperatures of the bottle content using your tongue or you suckle first. This is fine. Yes, you are leaving your saliva onto that baby's bottle. and then you're going to introduce your bacteria onto your baby, which will eventually multiply in a very rapid way and destroy your baby's teeth. Sometimes you get a spoon after mixing your formula with your milk, and then you test with this spoon with your sugar. Yes, then you dip again. That one, that one is a very, very, very bad habit. So if you're a parent, and please, 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 just try to adjust the things. And in most cases, they can be caused with uh, lack of enough fluoride. So when the fluoride is not enough in the content the baby is having, in most cases the teeth are weak, and eventually your baby's teeth will get hurt. Good news is there are ways we can prevent this. So my dear parent, as I told you, I'm going to make sure that I teach you, I give you all the knowledge you want so that we can have a better future. So how do we prevent baby bottle tooth decay? One, avoid sharing saliva with your baby. That is the major one. Avoid sharing your saliva with your baby. I know you love your baby so much. Even when you're kissing them, it is a sign of love, yes. But as you're kissing them, as you're pecking them, as you're suckling on your baby's fingers, and then the baby suckles on them also, you are introducing that deadly bacteria into their mouth. And as you're checking the baby's bottle with your lip, with your tongue, you're introducing the saliva, the bacteria to your baby. So please avoid that. Two, wipe your child's gums wherever they finish feeding. So how do we wipe them? Just get a good cloth or some piece of cotton. You just rub it onto your finger after they have breastfed or they fed on a bottle. You just pass it with clean water, clean their gums, train them. Then when teeth come in, when you see your baby has teeth in them, introduce a toothbrush to them. Teach them how to brush. And when the baby is less than 3 years, you use a size of a toothpaste to that of a grain of rice. Small toothpaste, small fluoridated toothpaste, small. Because they've not yet learned how to spit out toothpaste. So they brush and sometimes swallow, so you give them too small. Grain of a rice, yes. And between 3 to 6 years, then you can begin using a pea-sized toothpaste on their brush and teach them how to brush. Make sure you supervise your children's brushing. My parent, make sure you supervise them when they're brushing. One, they've not yet learned well how to spit, and they've not even known how to brush. So teach them how to brush and make sure they are spitting. This one is a cardinal rule. Don't put juice in baby's bottles. Don't put sugary things in baby's bottle. Don't put your honey in a baby's bottle. You can only put formula, which you call this packed milk, or you can put your breast milk. Yes, only that. Others use a cup. Don't put them in a bottle. Avoid putting your baby to bed with a bottle. My dear parent, yes, it is good the baby sleeps, but you are contributing towards the decay of your baby's teeth. These days we are getting cases. The baby is 2 years and a half, 3 years, and they're having caries all over, holes in the teeth. Can you imagine? Yet we can avoid these ones. Don't dip pacifiers into sugars and honey. My dear, the pacifier for that baby is not meant to have sugars. So just give the baby free pacifier. Don't introduce them to having a pacifier that is sweet. No, it will eventually cost you. So encourage your kids to drink from a cup by the time they are 1 year old. I have seen children, these are no longer babies, 3 years, 2 years, they come to a dental unit with a bottle. My dear parent, how can you have a baby 3 years and still using a bottle? 2 years and still using a bottle? Please encourage, train your kids to begin using cups by the time they are 1 year. Before they get their first birthday, they should have been introduced to a cup and able. Encourage health diet for your babies. So my dear parents, I'm here for you. You can send in questions about these topics. We agreed I'm going to be answering all of them. So send in questions through WhatsApp channel. The number is up there. Through Facebook page, you can just put your question there. Through the YouTube channel, through an SMS on that same number still. So we are here to answer all your questions and we are here to help. Thank you very much for being with us. Have a blessed day.